zoophilia and bestiality, deviant behavior, or mental illness. Throughout history, human sexual behavior has been a subject of extensive discussion across cultures, religions, and sciences. One of the most disturbing and controversial issues is the tendency of some individuals to be attracted to animals, which has come to be referred to, using clinical or descriptive terms, as zoophilia or bestiality. While the two terms are sometimes used interchangeably, they can point to different layers of this behavior, one being psychological or emotional inclination, the other indicating actual acts that go beyond moral, ethical, and legal boundaries. This type of behavior is not merely considered immoral or socially rejected. It is condemned across most cultures and religions as a grave violation of both human dignity and the natural order. Religiously, especially in monotheistic traditions such as Islam, Christianity, and Judaism, any form of sexual interaction outside the boundaries of human marriage is seen as a deviation. The act itself is treated not only as a sin, but as a corruption of human nature. From a scientific and psychological perspective, some researchers classify these behaviors under paraphilic disorders, where the person experiences intense and persistent sexual interests outside socially acceptable norms. However, the vast majority of psychological institutions do not view this condition as a harmless preference, but rather as a serious mental disturbance that requires clinical evaluation and intervention. The motivations behind such behaviors are complex. In many cases, they are linked to psychological trauma, social isolation, or extreme forms of compulsive fantasy. Some individuals may have experienced abuse during childhood or may suffer from deep emotional voids that push them toward bizarre or harmful outlets. Others may have been exposed to distorted sexual content that gradually desensitize their sense of morality and empathy. One of the alarming consequences of this behavior is the ethical and physical harm caused to animals who cannot consent or resist, making the act a form of abuse. Additionally, such behaviors pose a serious health risk due to the potential transmission of dangerous infections and diseases across species, threatening both individual and public health. Religious texts strongly emphasize the concept of human dignity and the sacredness of natural sexual relationships. Islam, for example, considers such acts to be major violations that require repentance and legal consequences. The preservation of moral boundaries is not merely for the sake of individual purity, but also for the safety and integrity of the entire society. Socially, individuals who engage in such behaviors often suffer from intense shame, rejection, and isolation. Their actions, once revealed, cause a rupture in family ties, social trust, and personal identity. The path toward healing and recovery is not easy, but it is possible. It begins with acknowledging the problem and seeking professional help. In many cases, cognitive behavioral therapy and moral rehabilitation can lead to significant improvements if the person is willing to change. In the end, whether these behaviors are classified as moral corruption, psychological illness, or criminal activity, what remains certain is that they represent a deep deviation from natural and spiritual norms. Treating the roots of such behaviors requires a comprehensive approach that includes psychological support, ethical education, and sometimes legal action. The goal is not merely to punish, but to protect society, uphold dignity, and offer individuals a chance at redemption through awareness, responsibility, and sincere change. If you enjoyed the video, don't forget to like, share it with your friends, leave a comment, and subscribe to the channel to get our latest videos.